These are the three Palmar spaces. Palmar spaces are mainly fascial spaces of the hand. Okay, three main Palmar spaces are there: Midpalmar space, Thenar space. See, this is Midpalmar space, green one. This is Thenar space, and over the fingers, pulp of the fingers, there are Palmar spaces of the fingers. These are the three main fascial spaces of the palm. And dorsal spaces are also there. They are not large spaces, very thin layer of spaces. One is dorsal subcutaneous space, just beneath the skin. Another is dorsal subaponeurotic space. These two are the dorsal spaces. Another is forearm space of Parona. Okay, this lies in the distal part of the forearm. Okay, so we will discuss the each of the Palmar space in details. First, their boundaries and in clinical aspects some. So mid palmar space. See, this is section through the palm here. At this region, you have taken a transfer section. So this at this level, here is the mid palmar space. This is Thenar space. So mid-palmar space is potential fascial space that lies deep to the medial half of the palm here, and shape is triangular and extend proximally extends up to the distal margin of the flexure retinaculum and distally extend up to distal palmar crease. Okay. Now we are going to communications. Proximally, it communicates with space of Parona and distally with fascial sheaths of third and fourth lumbricals. Okay, here are the two lumbricals, third and fourth lumbricals. So distally it continues with the fascial sheath of third and fourth lumbricals. Next, we are going to the boundaries. Anteriorly bounded by the palmar aponeurosis. Here is the palmar aponeurosis. And long flexure tendons of third, fourth, and fifth fingers. See, these tendon, three pairs of tendons. One is for superficialis, flexor digitorum superficialis. One is for flexor digitorum profundus. Okay. So these long flexure tendons of for third, fourth, and fifth fingers, they are lying anteriorly, and second, third, and fourth lumbricals. Along with these tendons, these are the lumbricals. Okay, second, third, and fourth lumbricals. Posteriorly lies the interossei and the metacarpals. These are the metacarpal bones. In between the metacarpals, these are the interossei, palmar and dorsal interossei. Next, we are going to the medial boundary. Medial boundary is formed by medial septum. Okay, here this one is the medial palmar septum. Lateral boundary by intermediate palmar septum. This one lateral intermediate palmar septum, and here laterally will be the lateral palmar septum. So three palmar septum extending from the two sides and mid of this palmar aponeurosis. Okay. Next, if infection occurs in this space, mid-palmar space, how will you drainage? Okay, you will get infected patients like this. So, infection of mid-palmar space can be drained by incising the third and fourth wave space here. Third and fourth wave space here you have to cut. Here is the incision point for infection drainage. Next, we are going to Thenar space. Okay, here is the Thenar space, the violet colored one. It is a potential fascial space located under the lateral half of the hollow of the palm. Its shape is triangular, and this is the extent. কিছু বলছিস? Proximal extent is up to distal margin of flexure retinaculum. Okay, and distal extent is up to proximal transverse palmar crease. These are the extent of this space. What are the communications? Proximally, it communicates with space of Parona. Space of Parona is in the forearm, distal part of forearm, and distal extent with fascial sheath of the first lumbrical. Here, one lumbrical is present just in front of the space. So, this extend distally with the fascial sheath of first lumbrical. These are the boundaries. Anterior boundary. These are forming anterior boundary and this is posterior boundary. Okay. So anterior boundary is formed by the thenar muscles. This is thenar group of muscles. Long flexure tendons for index finger here. This is long flexure tendons for index finger. Here is with the profundus tendon. This lumbrical, first lumbrical Palmar aponeurosis, this one Palmar aponeurosis and tendon of flexure pollicis longus tendon. So these are forming the anterior boundary. Posterior boundary is formed by the transverse head of adductor pollicis. This one is transverse head of adductor pollicis. And rest also you can say the metacarpals and the interossei. Okay. Next, medial boundary. This is medial boundary formed by intermediate palmar septum. Lateral boundary by the lateral palmar septum. Okay. And now, if infection occurs in this thinner space, it can be drained by incision in the first wave space. Here you have to cut. Okay, for first in the first wave space. And other incision lines also you see here. This is incision line for radial bursa infection. This is incision line for ulnar bursa infection. Okay, and these are for infections in the digital synovial sheath. And on the lateral side of the pulp face, you incise for pulp face infection. Okay, and here in the forearm, you incise for infection in the space of Parona. Okay. So for Thenar space infection, you have to incise at the first wave space in between thumb and the index. So these are the summarization of these two spaces. These two comes in your theory, long question. Okay, Midpalmar space and Thenar space. Where is the location? Midpalmar space on the medial side of hollow of palm. Thenar space on the lateral side of hollow of the palm. Communicates proximally. Both of them communicates with space of Parona of the forearm. Distally with the fascial sheaths of third and fourth lumbricals for midpalmar space and fascial sheaths of first lumbrical for thenar space. And drainage air midpalmar space can be drained by incision in the third or fourth wave space and thenar space can be drained by incision in the first wave space. Okay. Next we are going to Pulp Space of Fingers. Okay. Pulp Space comes as a short note mainly and its clinical aspect, Felon, infection of pulp space, that also comes as a part of long question or a short note. Okay. So what is pulp space? This area you can see the soft tissue around the distal phalanx. This space is forming the pulp space. Okay. So it is a small subcutaneous space on the palmar side of tip of the fingers and the thumb. What are the boundaries? Superficial boundaries by skin and the superficial fossa. Hairs, skin and superficial fossa. Deep boundaries formed by the distal phalanx, bone. Okay, and numerous fire septa extending from skin to the periosteum of the distal phalanx divide the pulp space into multiple loculi. See this deep fossa, the blue one is the deep fossa, and from here this fibrous septum extending from the subcutaneous plane up to the distal phalanx, periosteum of the distal phalanx. And these septors are dividing the pulp space into multiple um, loculi, and these loculi contain mainly fat pad, okay, and some blood vessels, nerves lying along the lateral aspect. What are the content? You can see this is the skin and superficial fascia, outer boundary. Deeper aspect lies this distal phalanx, and these two are connected by fibrous septa. Fibrous septa dividing the space into multiple loculi, and these are the contents. This loculi content fat, and this is the digital artery. Okay, also lies the digital nerves. So content is digital artery and subcutaneous fat. Okay. You practice a schematic diagram like this. Okay, now we are going to clinical aspect of this. So what is infection of Pulp space? Due to pus formation in the Pulp space and non-expanding nature of this space, avascular necrosis of distal 4/5 of the terminal phalanx may occur. Okay, in case of infection, there will be collection of pus. Okay, and it will compress the artery. So blood supply will be lost to the distal phalanx, and it will undergo necrosis, avascular necrosis. Okay, but this proximal 1/5 does not undergo necrosis, because distal phalanx, proximal 1/5 of distal phalanx does not undergo necrosis, as its branch does not traverse through the pulse space. Okay, it is coming from the proximal aspect. Now, what is Whitlow? Whitlow or Felon? This comes in your Viva and MCQ. It is a pus formation in the pulse space. Whitlow or Felon. It is painful because of unyielding nature of the space. There is no space for expanding. If pus collection occurs, it will compromise the other structures. Okay, so that's why there is severe pain in pulse space infection. Next is skin incision for drainage of pulse space. A small lateral incision opens all the compartment of loculi. Here, these are the lateral incisions given for pulse space infection. Okay. So incision line you have to remember for treatment of your patients. Okay. Understood? Okay, that's all. So you prepare Midpalmar space and Thenar space, boundaries, contents, all this, and in clinical aspect. These two comes in your long question, Midpalmar or Thenar, and Pulp space comes in your short question or short note. Okay. Viva MCQ, important, Whitlow or Felon, and those incision lines. Okay.